A microbiome is the composition of the gut. What bacteria reside in the gut? What percent of immune system resides in the gut? Ed, don't say it. Yeah, about 70%, right? So this is like this is our skin and gut are the biggest barriers. And what we know is that the more diverse your gut flora is, the more rich your microbiome, the healthier your immune system, and the better you're able to fight off cancer and other autoimmune conditions. So much so that people with metastatic and early stage colorectal cancers, melanomas, are getting fecal implants to actually boost the immune system. And we know that we can treat folks with certain immune therapies to turn the immune system into Superman. And if we actually tickle their gut flora and the immune system into fighting and recognizing the foreign entities, they have drastically different outcomes. What I mean by drastically, they live 2, 3, 4 times longer than average. And the thought is, well, can we bring this earlier? And this is based on population studies, looking at different, looking at population studies and seeing who has healthier gut floras and what is it predisposing our risk to, and how long does it take to change your gut flora. So population risks of Americans and Africans were done, and who do you think had a richer gut flora? Yeah, Africans, right? And then their diets were reversed, right? So the Americans were fed an African diet and the vice versa. And in 3 weeks, their gut signature changed. Now, we aren't always able to do this, right? Because I see patients and we check their microbiome and we say, okay, you need to be doing more fiber, you need to be doing more whole plants, and they can't. I'm like, well, I'm just going to pop a pill. Ain't going to work, right? So sometimes you need to heal their gut, and so that, you know, it's not leaky and they're able to absorb. But it's a path and a goal, right? You need to heal and enrich your gut, and that will lead to much better health. Food is a huge component, and not food as medicine as far as not supplements, but as far as risk reduction in specific population with specific components. So plant-based whole food diet has been studied in colorectal survivors, in pancreatic cancer patients, in addition to tree nuts. And what's been shown is that if survivors of colorectal cancer have a handful of tree nuts post their diagnosis, they reduce recurrence by about 40%, which is pretty much equivalent, if not better, to chemotherapy. You know, if you have about 30 grams of whole food fiber, then you decrease your risk of colorectal cancer by about 30% and upper GI cancer by about 20%. If you take 30 grams of fiber in the form of Metamucil, what's your risk reduction? 0. So playing God, albeit attractive, doesn't replace God. You know, we have all of these things, just eat them. Eat whole food, please, you know. Eat whole food, eat nuts, eat things that are more stationary as opposed to more moving. Better for you. So this is the last slide, and I just want to give you a visual representation of how this plays out internationally. And this helped me to frame this. Are we really number one in health? Are we really number one in disease? So these are the rates of breast cancer and prostate cancer in the world. We are here. We're pretty much the top of the pyramid as far as the incidence of cancer, both for breast cancer, prostate cancer, but you can easily replace this with colorectal cancer, uterine cancer, ovarian cancer, melanoma. Colorado is the second place in the world for melanoma outside of Australia and New Zealand. That's obviously because in the rest of the world, there is no sun, you know, obviously. And incidentally, just saying, New Zealand is the dairy capital of the world. Just a coincidence. So the slide is brought to you by meat and dairy industry. So the rates of breast cancer are 300% higher here than they're in Asia. And they're nearly 1,000% higher here than in Asia. And when you take this population within 1 to 2 generations and you plop them here, they are here. That's obviously because their genes have mutated, right?